Welcome back. Continuing the news. In this evening's health report, Shamela Pullen looks at stroke and medications.
Every year, approximately 10,000 Jamaicans suffer from a stroke, with 3,000 resulting in death. Hypertension tops the list of risk factors. According to Dr. Karen Phillips, consultant family physician and endocrinologist, many individuals fail to take their medication, exacerbating the issue.
You try to tell a patient about indefinitely, forever, for the rest of their lives. Even if they are 80, they will say to you, for the rest of my life, nobody wants to do anything for the rest of their lives. Then on top of that, the men, they don't want to take them. A lot of these drugs can affect your erectile function, and so men really are problematic in that area. They do not want to take their medications.
According to Dr. Phillips, the condition poses a significant threat beyond just death. The greater concern, she notes, is morbidity, the long-term health consequences and disabilities that can result when an individual suffers from a stroke.
Morbidity is really, alarming and disheartening, because we're seeing a lot more younger strokes. So whereas in the past, stroke was more confined to the older age group, now we're seeing young persons with stroke in their 20s and in their 30s. And so this is a cause of concern, because a lot of them basically, they're at the peak of their productive years, and you lose that in terms of productivity. And we don't have a lot of options in terms of dealing with the rehabilitation locally.
Despite trying various approaches, Dr. Phillips says encouraging patients to take medication as prescribed is yielding mixed results.
Sometimes I try to reason with them, I try to explain to them why it's important, and then sometimes I just have to come straight up. This is what you're doing to yourself, this is what you're setting yourself up for, and don't say I didn't tell you, And sometimes that works, sometimes it doesn't work, and it only works maybe when I see them on a stretcher in the hospital with a massive stroke, unfortunately.
With your health report, I'm Shamela Pullen, wishing you good health.